Parents, if your child has suddenly developed an onset of motor tics, anxiety, OCD, brain fog, exhaustion, emotional and behavioral dysregulation, gut challenges, and getting sick all the time. And when this stuff comes, it comes really, really fast. And you find you and your family living on this emotional roller coaster, not being able to figure out what's really going on with your child. And maybe you've taken that even further and you've gone to the pediatrician, you've gone to the neurologist, you've gone to the specialist, and you still are left feeling dismissed and feeling confused as to what's really going on and how it all ties together. I want you to know this. There is hope and there is light at the end of this tunnel if those symptoms, and especially with the sudden onset, and they're kind of here and then gone on this roller coaster sort of behavior, if you will, to these disorders, if that sounds like your child, it's very likely that they're struggling with one of two complex disorders, either PANDAS or PANS. And we're going to break down those acronyms. We're going to break down those definitions. We're going to break down the neurophysiology and the science behind them. And we're going to get into the drug-free action steps you can take to help your child heal through these tough, complex, confusing disorders and get to the other side. And that is a tough journey for a lot of families because these are tough conditions. So for the last 10 years, we've seen more and more of these cases, and it used to be just teenagers. Now it's even as young as grade schoolers, and even before, they start to come down with these infections because that's where a lot of this stress begins. But we'll actually dig deep and you'll see that there's kind of this relay race happening between the nervous system and the immune system. And then, medically, they would call it the psychiatric system, which is the emotional anxiety and behavioral dysregulation comes from. But that's why this is tough to tackle because it's not a singular system and there's not a singular cause or trigger to these pandas and pans disorders. There's a lot going on. And one of the real challenges right in the thick of this opening address here is that medicine really struggles to help families in a conventional standpoint. Number one, because everybody is siloed in the medical system. You have your general pediatrician, then you've got your neurologist who looks in this window, then you have your gastroenterologist that looks in this window, and then you have your immune system doctor, your immunologist that looks in this window, and then you have your geneticist over here. And what happens for families is you go to all these different specialists and all these different symptoms that are kind of tethered together here with pandas and pans, and nobody gives you one cumulative answer as to what's really going on. So we're going to really get into the thick of it with this video. We're going to get pretty nerdy. We're going to go through a lot of big words, but I promise you we're going to keep it really simple, really straightforward, and really actionable at the same time because over the years, our clinic and myself have really specialized in taking care of these tough cases. And what you're going to see is, to simplify it for the sake of simplification, is we need to address the two-part problem that is pandas and pans with a two-part clinical protocol. But the most important thing I want you to take home from this video is the order in which we address this and take care of kiddos struggling with pandas or pans is the most important thing. And for families, that's really difficult because you have this multitude of symptoms in a multitude of different systems within the body show up almost overnight all at once. So you want to take this take everything on all at once approach to get your kiddo to heal. But the one thing I want to say right out of the gates is that what we know with pandas and pans is that the patient's nervous system is not only stressed out, not only disorganized and dysregulated, but it becomes exhausted. And so what we need to do is to be patient and persistent, and we need to really put the healing mechanisms in the right order to get maximum results in not only the short term, to get your child out of the storm, and they may be stuck, the storm they may be stuck in right now. But here's what I really want you to know is we're gunning for with this video is to get you to the other side of the pandas and the pans, what we call the perfect storm, and keep your child healthy, stable, resilient, and able to not only get to the other side of these stressors and these challenges, but stay there and get back to that full expression, high quality, optimal life as well on the other side. So let's break down this. Number one, let's give you the nerdy definition. PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infections. So what it means is we see it in kids. Most commonly pediatrics. And what it means is that we have an autoimmune component and a neurological, neuropsychiatric component. And then the final two words, the streptococcal infections, is we have something that really hits the hot button. What happens with these latent, lingering, loitering strep infections is the location. So we're running out a bunch of L words here. What happens with strep infections and where they set up shop? It's an opportunistic infection that for a lot of kids, because we've overused antibiotics and all these things will break down so much. Our kids' nervous systems, even before PANDAS and PANS sets in place, our kids' nervous systems are already stressed out, disorganized, dysregulated, and maybe even exhausted. So what happens is we lower their resistance. I shouldn't say we, but the medical system, their resistance, they lower their resistance, their neurological adaptability, their immune responsiveness is lower. We have the sickest, most stressed generation of kids ever. And so, what this has done is it's created an opportunity for opportunistic infections like strep to set up shop and stick around more often than they should. But what happens when we study pandas, and we'll get to pans next because it's very similar, it can just be a different group of pathogens that gets in, is when you really break down the case history, you often will see exactly that. That is streptococcal infection, some sort of illness. So we see big spikes and peaks of pandas and pans and anxiety and motor tics and all these sort of things in the spring and the fall when these infections are more likely to set up shop in the system. But you'll see it and trigger the onset of these neuropsychiatric or neurological disorders. But I want you to keep digging with me when we take our job as nervous system focused pediatric chiropractors and we go all the way back to the beginning of life for kids struggling with pandas and pans, we actually find signs of neurological dysfunction, dysregulation, and a term that I really want you to take from this video called dysautonomia before the strep infection even sets up shop. So I want you to map out with me here is that we actually often are dealing with dysautonomia, so nervous system stress and dysregulation first, which then opens the door to the strep infection to get in, to set up shop, to stick around, and to get worse. And as it gets worse, it comes back again into the nervous system, into the vagus nerve, in the autonomic nervous system, and it makes an already stressed, already overwhelmed nervous system even more stressed, even more anxious, even more tense. And so that's where the muscle pain and the motor tics come from. And so it's neurological, then immunological, and then neurological again. Now, the reason I need to map that out, and I know I probably should have a whiteboard to be drawing this all out for you so you can see the visuals of this. You got my hand gestures and my nerdy words. Is this medicine, traditional, conventional, pediatrician, neurologist? They're going to miss all of this. They're just not going to do a good job finding this. Second, though, you go into holistic, integrative, functional medicine, and they're rightfully, accurately, but perhaps incompletely going to blame the infections and target the immune system component all by itself. And the most important thing I can have you parents really be able to pick up from this video about pandas and pans, and I know we're going deep and I know we're getting intricate, is the original stressor is actually trapped into the central and autonomic nervous system first and then's up back there again. So the most awesome, exciting thing about understanding this neuropathophysiological pathway that leads to this perfect storm of pandas and pans is that we have to go all the way back to the foundational dysregulation, dysfunction, and dysautonomy of the nervous system to get it out of there. Now, I already started to get into this three-step process and perfect storm components of this. But I want to just give you the definition of PANS as well. PANS is the pediatric acute onset neuropsychiatric syndrome. So oftentimes other stressors, other things like influenza, pneumonia, RSV, or even food poisoning, or a bad fall, a concussion, or a neck injury can trigger things like PANS, PANDAS, and also POTS, which is very similar in this conversation because it's rooted in dysautonomia and vagus nerve insufficiency, but we're getting a little bit more focused on the immune strep PANS connections here. So the question is, are we dealing with a neurological disorder? Yes. Are we dealing with an immunological challenge? Yes. So, in what order can we most help a child? Because what we know is that once this perfect storm vicious cycle sets in, the body is going to be filled with inflammation. That is why the child is so sensitive to certain foods or certain illnesses. And also, overnight, they're sick, inflamed, and out of gas again. But the original trigger of that again is something called subluxation and dysautonomia. So what I want to do for you in this final bit of this video is I want to really break down the component and teach you not only what it is, but how to find out if that's the real foundational true root cause of your child's pandas and pans. So what we're looking at is an HRV, heart rate variability scan of a pandas kiddo. But the way the nervous system works is the central and autonomic nervous system is really the roots of a health development tree. And then you have things like the trunk, which is the gut and the immune system. And so we really got to get down deep to really take care of things in this way. And so what we're looking at right here, like I said, is an HRV exam of a child whose nervous system is completely sympathetic dominant. So when we look at this and we see this little white dot over here, right there, they are stuck in that sympathetic fight or flight storm, which is going to leave their body in a pro-inflammatory state. That's the fight or flight side. And that's what leaves their body in that pro-inflammatory state, which is going to leave their body in a pro-anxiety, tension, motor tic sort of state. So this is too much gas pedal tension. And then when you're on the sympathetics for too long, what happens as well is the body then goes down this way on this axis and it ends up being exhausted as well. But when we find on this HRV exam, which I'm going to leave you with is here, that is by far and away the most important test to get on your kiddo with pandas and pans. Now, I know because we're dealing with these ongoing strep infections and this neurogastro immunological inflammatory cascade that running functional med, integrative med labs may seem like the first most important move. And I want to get you to see that they are, but maybe that's 1B. We work hand in hand with incredible functional medical teams because what it really takes to get a kiddo out of this pandas, pans, perfect storm is both. But the most important thing that you can take home from this video is we actually have to get the nervous system out of that sympathetic storm, activate the vagus nerve on that HRV, move it towards the green zone, get it in a more resilient, adaptable, healing state. And then we can go at the inflammation, and then we can go at the immune system dysfunction. And so if your child, or if you've tried to support your child's immune system, you've tried to attack inflammation and bring it down, and you've gotten some change, but not all the way better, and you know they're still sensitive to these seasonal changes, to these infections, to all these things, the missing link, the missing first foundational step may just be addressing dysautonomia, vagus nerve dysfunction, and subluxation. So click the link below where you can read not only articles about pandas and pans, but you can read more about vagus nerve, about the perfect storm, about dysautonomia, about subluxation and the sympathetic nervous system, because that is where the real answers lie to get into the action steps to get your child's nervous system healing first so it can better support the immune system and inflammation healing. And you do so in that sequence and in that order. And I promise you, this two-step, two-phase approach, which may take many months to get done altogether, but that's the pathway, that's the roadmap to get your child to the other side of their pandas and pants challenges. And when you do this with the best nervous system focus chiropractors, partnering up with you and with your functional med and with your integrative doctors, that's the process to get to the other side of the storm and stay on the other side of the storm. This is a complex, multi-layered challenge. So please, any questions or any more information you need, comment below, send us a DM, hit those links, go read the articles, learn more about the neurological focused approach to pandas and pans. And when you pair it with a functional med and integrative health approach, that's where real, complete, drug free healing can happen for your child. We're here always for hope, answers, and drug free help. And anything you need, reach out. We've got you, you've got this, and we'll see you in the next one. Take care.